Hello everyone, welcome back to my channel. If you're new here, hi, my name is Charlotte. I'm a registered nurse. Today I'm very excited to be sharing with you the 6th episode of Nursing 101, a series in which I share with you skills and topic reviews which you will come across and learn in nursing school. Today we're going to be reviewing our vital sign parameters across the ages so that when you start placements and lab sessions or your first nursing job you feel confident and prepared to look after any patient. So we're going to be covering the normal parameters, the normal or expected parameters for each age group, but we're not going to go too in depth into abnormal or unexpected results. So all of the information that I use in this video is accurate and can be found in the description box of this video in case you want to do some more reading. Before we get into everything, don't forget to like, subscribe, do all of that good stuff, but for now, let's dive right in. So in Aotearoa, we have a couple of different charts which we use in clinical settings in order to monitor patients' vital signs and monitor patient deterioration. For adults, this is the early warning score, or the EWS. For children, it is the Pediatric Early Warning Score, or the Pews, and for pregnant people, it is the Maternal Early Warning Score, or the MEWS. With the Pediatric Early Warning Score, there are a couple of different charts depending on the age range, because as children get older, their physiologies change, and as a result, the vital sign parameters for each age range also changes. So these early warning score charts tell you whether a vital sign value that you got is unexpected or abnormal, and it will prompt you to follow up on it as well. So they're really important and useful tools to have in managing patient deterioration and just, managing baseline as well. And because of this, if you're going into clinical, don't worry too much about memorizing absolutely everything because there are charts there to help you. So instead focus on memorizing all of the adult vital sign parameters, and then over time you will start to become more familiar with maternal and pediatric vital sign ranges and what seems off regarding vitals and your observations. I also want to note that vital signs are more of a guide anyway. They're incredibly important, but because everybody is slightly different, the most important tool that you have when managing and monitoring for patient deterioration is your observation skills and what you notice about a patient. Things like their colour, their work of breathing, their level of consciousness, their appetite, their input and output, all of these different things. Their vital signs may be completely normal, but if you are looking at somebody and you think this isn't quite right, that is the most important tool that you have to be able to start to follow up on things that you think are off. So the vital signs are incredibly important, but they are just one part of monitoring and managing for patient deterioration. So in this video, for my vital signs ranges, I am going to be using the Pediatric Early Warning Score and the Early Warning Score as my guideline. These are the vital sign ranges that we have here in Aotearoa. They may be a little bit different from country to country, but they shouldn't be a significant difference in the values. So with that in mind, let's start with the first vital sign, which is heart rate or pulse, and that is how quickly your heart is beating in order to pump blood around your body. It is affected by preload, contractility, afterload, and also by the parasympathetic and sympathetic nervous system. So for adults, the expected parameters are 60 to 100 beats per minute. This is the same for pregnant people. Their maternal early warning score shows that 60 to 100 beats per minute is the expected parameter. For children, if they're between 0 to 11 months old, their expected parameters are 110 to 150 beats per minute. If you're between 1 year and 4 years old, your expected parameters are 90 to 140 beats per minute. If you're between 5 and 11 years old, the expected parameters 80 to 130 beats per minute. And if you are 12 years and older until you're about 18, the expected parameters are 65 to 110 beats per minute. Moving on to blood pressure, which is the pressure within the arteries. It's measured by two values. There we have the systolic, or the top number, which is the pressure within the arteries when the heart contracts and squeezes all of the blood out of the heart. And we also have the diastolic, or the bottom number, which is the pressure within the arteries when the heart relaxes and blood enters and fills up the chambers of the heart. So for adults, we want anything 120 over 80 milligrams of mercury or less. We don't want anything below 90 over 60 milligrams of mercury. Regarding our pregnant patients, it's also really important to monitor their blood pressure quite regularly because we want to be able to catch and manage gestational hypertension and preeclampsia if the condition arises. So the normal or expected parameters for maternal blood pressure, gestational blood pressure, is 100 to 130 over 40 to 80 milligrams of mercury. For children, it's important to note that we don't really consider the diastolic value very much. Mainly we focus on the systolic number, and you'll find this if you look through the Pews chart. It is labelled in the section of the graph which talks about blood pressure that the systolic value is the one to be considered. So for 0 to 11 months, the systolic value that you want is between 75 to 100 milligrams of mercury. If you have a patient that's between 1 and 4 years, the systolic value that you're looking for is between 90 to 110 milligrams of mercury. If you have a patient who's 5 to 11 years old, your systolic value that you're looking for is between 90 to 120 milligrams of mercury. And for patients 12 years and over, we are looking for 100 to 135 milligrams of mercury for the systolic value. So the next one is respiratory rate, which is how quickly you are inhaling and exhaling. Interestingly enough, is one of the first vital signs that will kind of go a bit funny when you have a patient who's starting to go into distress. But it is also the vital sign that most people will forget or kind of just guess, and it isn't done properly. When you're taking your vital signs in your patients, please make sure to also take their respiratory rate and do it properly, just because this vital sign, as I say, is one of the first to go. So for adults, you're looking at anything between 12 to 20 breaths per minute. For our pregnant patients, we're looking at anything between 10 to 20 breaths per minute. If you have a patient who is between 0 to 11 months old, then 30 to 49 breaths per minute. It's a lot faster than the adults. So 30 to 49 breaths per minute for 0 to 11 months. For patients 1 to 4 years old, the breathing is 20 to 39 breaths per minute. If you have a patient who's between 5 and 11, the respiratory rate you're looking for is between 20 to 29 breaths per minute. And if your patient is 12 years up to about 18, you're looking at 15 to 24 breaths per minute. So as you'll probably notice, when you're a little child, your vital sign ranges are typically a lot higher than when you're an adult. And as you get older, things start to slow down. So temperature is really easy to remember because across the board for all ages and all conditions, it should be between 36.5 to 37.3 degrees Celsius. Just a note, older patients potentially run a little bit colder, tiny bit colder, but again, it shouldn't be a significant value. But just keeping in mind that, again, some people are slightly different, and just, you know, considering your other observations as well. Oxygen saturation is also really easy to remember because, again, across the board it is 95% and over. The only real exception to this rule is if you have an adult patient who has chronic obstructive pulmonary disorder or COPD, and they will comfortably sit at between 88% and over. So normally 95% and over for anybody, apart from if you have an adult patient with COPD, and in that case it will be 88% and over. So on a final note before we go, your observations are one of the most important tools that you have in noticing and managing patient deterioration. Vital signs are part of that, but it is also critical, especially with children, that you take into consideration family or whanau concern. If a family member or a main caregiver says that there is something wrong with their child, that they are not acting normal, that this isn't normal for their child, typically, most often they are correct and it needs to be followed up, and you should take their concern as another vital sign. So that was today's video and episode of Nursing 101. I really hope that you all found it helpful, and as I said before, I link all of the information and resources that I have used in the description box so that you can kind of just peruse at your own leisure. Thank you very much for watching. I really hope you enjoyed. Don't forget to like, subscribe, do all of that good stuff. I'll see you next Monday with a new video, but until then, have a lovely day and a fabulous week. Bye!
It's rated X. That means you're extra, extra.